today it's Monday night, and then this is a brand new week. So let's have some fun and let's get some more information about why a person actually develops skin conditions.
Hi, Joanne.
Okay.
Yeah, we can always admit them later.
Yeah, no problem. So we can just admit, no problem. Yeah, there's
Hi,
Christy,
no.
there's Roger.
Hi,
Okay,
Eugene.
good.
Welcome.
Okay, now it's 8:35. Thank you very much. What I'm going to do now, allow me to do a proper introduction of tonight's guest speaker, which is very, very important. All right, thank you everybody investing a precious time tonight on a Monday night to actually log on to our Zoom session to actually find out, okay, on tonight's topic, how does a person actually develop a skin condition? Tonight's date with Dr. Chong, this is the whole series, this is chapter number 2. So for tonight, for yourself or for the friends that you love or for the family members, a lot of us actually have skin condition or develop skin condition. And this is a very important topic and a very critical topic because most of the people around us are having this same condition. For example, like my youngest boy, my youngest son, when he was born, basically there is actually skin rashes being developed. And then throughout the first 6 months, there is a lot of skin rashes, eczema and all that. No matter what sort of cream we use, it will always be affected. And for some people, the skin condition actually flare up, all right, from time to time as they are growing up in that sense. Okay, without further ado, to allow me introduce Dr. Chong and his background. Okay, a little bit about Dr. Chong. Basically, Dr. Chong Sai Ho, he is actually graduated from Ireland MBBCH BAO. He's a professional diploma aesthetic medicine, LCP certified aesthetic physician, graduated from Trinity Medical College, Dublin since 1996. And he is also the medical practitioner with vast experience in family medicine for more than 25 years. And most importantly, he has been an aesthetic physician specializing in anti-aging medicine since 2017. Okay, so with this, without further ado, allow me to hand over the session to Dr. Chong. Okay, I hand over to you. You can show the icon on and clap a bit. Yeah, correct. Yeah, okay, good. Okay, Dr. Chong, hand over to you now, Dr. Chong.
Hi, Marcus. Hello, can you hear me?
Yes, we can.
Yes, Dr. Chong,
Okay.
we can hear you, yes.
Okay, can you see the screen that I shared?
Yes, Dr. Chong, we can see your screen now,
so-
your first screen, your first slide. Okay, you're on.
Okay.
Thank you.
Thank you very much, Marcus, for the kind introduction. Hi, I'm Dr. Chong from Malaysia, and tonight I'll be talking about 2 common skin conditions. They are what we call the psoriasis and eczema. Okay, hi everyone. Wherever you are, I hope you guys are well and safe during this pandemic. Okay, tonight I'll be talking about these 2 conditions. I'm sure many of you will have somebody in your family or somebody you know. Okay, so tonight I'll be talking about these 2 conditions so that you can get more understanding and know about what are the treatment options available. Okay, what is psoriasis and eczema? Both conditions are actually chronic, hereditary, inflammatory skin conditions with rather similar symptoms, but there are ways to tell them apart. And by chronic, I mean that these conditions are actually long-lasting. They are not short-term, they are long-lasting, and they can last actually a lifetime. Hereditary, that means this condition can be genetic. That means it tends to run in the family. Let's say your father has it, your chances of getting the condition is actually higher. Inflammatory means that in both conditions, inflammation is a prominent feature in the condition of the diseases. And both of them actually what we call like quite similar ways. Both of them are red and itchy rashes on your skin, but they're actually 2 very different diseases. Okay, let me talk about eczema. Eczema, we also call them as atopic dermatitis. It's actually a condition that makes your skin red and itchy. And when we talk about eczema, normally we see eczema in children. They normally actually occur in children. And But they're not only what we call that like limited to children. They can actually go through adulthood as well. And this is a chronic condition whereby this eczema can be long lasting and they tend to flare up periodically. That means like when you have eczema, it doesn't mean that you'll be having eczema 365 days a year. There are good times and bad times, and sometimes you have it and sometimes you don't get it. When we talk about eczema, normally those people who have eczema, they normally have other conditions as well. They can be asthmatic and they have rhinitis or sinusitis at the same time as well. And this is what we call the triad of Atopy. And this eczema thing is very genetic, and there's always an allergic component to it. That means like eczema can be triggered by things like pollen, can be triggered by things like dust mites, triggers by pollution, air quality, which is very bad, and cats and dogs, dentists, animal and pets. In psoriasis is a condition that causes skin cells to multiply at the rate of up to 10 times faster than normal. In psoriasis, there's no component as what we get in eczema like allergy. Psoriasis basically means that our skin are actually multiplying. They're actually producing more and more skin cells at the rate very fast than our normal rate of producing skin cells. So this sort of accumulated or overproduction of the skin cells tend to build up into bumpy red patches. That means we have a lot of thickened, skin cells causing a lot of silvery and white scales on the skin. And this actually, compared to eczema, these sort of like rashes are actually more demarcated. They are thicker than usual, and they are not as ill-defined as eczema. Okay, how psoriasis and eczema feel different? Okay, in eczema, the common symptoms of eczema is actually itch. Itch is a very prominent sign of eczema. It can get so bad that, the person catches the rashes so bad that the skin might start to bleed. And normally this thing you see in children, when they come to me, they go to the doctor in the consultation room, they normally present with a lot of scratch marks on their body. Psoriasis, whereas, can also be itchy, but this is not a prominent sign of psoriasis. And psoriasis can be more than just itchy. The skin can be stinging or even burning. And some say that it feels like you're getting bitten by fire ants in psoriasis. Okay, the difference in appearances of psoriasis and eczema. Okay, in eczema makes your skin very red and inflamed, and it may be scaly, oozing, or crusty. And you may see some rough and leathery patches that are sometimes dark, and it can also cause swelling. And eczema are normally ill-defined. You don't see a very clear border around the eczema rashes. In psoriasis, whereas, it can also cause a lot of red patches. They tend to be more silvery in color and tend to be more thick and scaly. And they are raised up high, quite thick, and we call them actually plaques. And if we look closely, the skin is much thicker and more inflamed than compared to eczema. And how psoriasis happens? Normally, skin cells are replaced every 10 to 30 days. This is actually a normal physiology in our body. Our body will produce new cells every now and then to replace the old cells. Normally, it takes about 10 to 30 days to actually produce the new cells. But in psoriasis, the new cells actually grow very fast. It takes about 3 to 4 days to replace itself. So the buildup of these old cells, because of this accumulation of new cells being formed, actually replace the new cells, creates those very thick silver scales. And what are the symptoms of psoriasis? Okay, these are the symptoms of psoriasis. Okay, the symptoms actually varies. It doesn't happen to everybody who has psoriasis, but commonly you get these plaques, psoriasis, and you see a lot of plaques of this red skin, often covered with silver colored scales, and they can be itchy and painful, and sometimes crack and bleed. And these plaques can grow and merge together and causing the plaques to become bigger and larger, covering more and more larger surfaces of the body. And as compared to eczema, which only affects the skin, psoriasis actually causes other areas other than skins, like our fingernails. We can get pitting on our fingernails, our toenails, and they can cause discoloration of the nails. And the nails can actually crumble and detach from the nail bed as a result. And these plaques are actually quite another prominent feature of psoriasis is they normally occur on the scalp and hairlines, which you normally don't see in eczema. So I'll just run through some common types of psoriasis. Can you all follow? Am I going too fast?
Yes, can follow.
Can follow. Yes, we can follow.
Okay, good. Okay, let me just run through some common types of psoriasis. Okay, basically I'm trying to illustrate here is psoriasis do not present in all the time the same thing in everybody. There are actually different types of psoriasis presentation. Okay, this one is called what we call pustular psoriasis, and it's actually the same thing, with red patches on your skin, but it's actually associated with a lot of pustules, a lot of pus on the skin itself. And this can be a very serious condition whereby the patient who comes out with this thing can be quite sick with systemic problems like fever and things like that. And it needs to be treated immediately if someone has this pustular psoriasis. The second one is scarring psoriasis. And this one is quite common, and you commonly see this thing in childhood among children. And they actually very small little spots, red spots, and they drop like very little from about 2 to 5 millimeters, and they're normally present on the torso. Torso means our bodies, and the limbs, the upper and lower limbs. They hardly actually present on the scalp, on the face. And the triggers of this thing normally is because of the streptococcal infection. It's very common you see in this among children after they have actually come down with streptococcal throat infection. They ended up having this thing being triggered. And other streptococcal infection also do the same thing, like streptococcal infection of the skin and other, what they call that, URTI, like bronchitis and respiratory symptoms as well. And another type of psoriasis is what we call inverse psoriasis. And these are bright red shiny lesions that appear in skin folds, such as in the armpits, groin, and under the breasts. Another one, which is very extensive, what we call psoriasis problem, is what we call erythrodermic psoriasis. And these are actually very fiery redness of the skin covering most parts of the body, and they can be actually triggered by severe sunburns or infections or certain medications. And when somebody has psoriasis and they suddenly stop their treatment, they can have this thing be triggered. And this also needs to be treated immediately because it can lead to severe illnesses and complications. Right now, you might want to ask what causes psoriasis. To know what causes psoriasis, you need to know that we have DNAs in our body, and DNA is actually different from person to person. Okay, inside the DNA, we have different genes, and what genes do, they actually instructions for our cells to behave and carry out functions. They control things like our eye colors, our hair colors, if we can taste or certain things, or how our immune system function, what's our skin color, and other ways our body works. And it's important to know that these genes are not active all the time throughout our life, and they're only active. They sometimes are being what we call silent, and sometimes they're being switched on from time to time during our life. In psoriasis, okay, what happens is the genes that control our immune system signals actually got mixed up. So instead, our immune system actually supposed to protect us from the invaders or from germs and things like that. It's actually a body's defense system. But instead of doing just that, okay, this immune system starts to promote inflammation of our skin, causing our skin to go into an over-response and overdrive, producing too much of actually skin cells. And normally, about 10 in every 100 people have genes that make them more likely to get psoriasis, but not all of them will actually develop psoriasis. Only 2 or 3 of them actually do. As I said earlier on, some of the genes, even though you carry the genes, but if the genes are not turned on, you won't get the psoriasis. Psoriasis happens when there's more trigger factors. Okay, the number 1 factor is hormonal change. Okay. When there is an hormonal change or imbalance in your body, like during puberty or menopause, there will be a trigger of psoriasis. So it tends to happen during puberty times and menopause time. And people who have psoriasis when they're pregnant, okay, because of the different change in hormones, they actually get better. With the psoriasis, you get better when they're pregnant. But after the baby is born, that person might develop the psoriasis again. The second factor that triggers the psoriasis is alcohol consumption. And heavy drinkers tend to have higher risk of developing psoriasis, especially in young people. And those people who have psoriasis, and if they're a heavy drinker, the effect of the psoriatic treatments are actually less effective as a result. And smoking is another factor that can cause the psoriasis to happen. And smoking actually doubles the risk of a person developing psoriasis. If you have relatives with the disease and you're a smoker, you are 9 times more likely to get psoriasis. And when you get it, it's harder for you to get rid of it if you do smoke. And this smoking psoriasis tend to be closely linked to the one I just talked about, the pustular psoriasis, which normally affects the palms and the soles. Okay, another very important triggering factor is actually stress. Scientists think that your immune system may respond to emotional and mental pressures the same way it does to physical problems like injuries and infections. That means basically stress can trigger the immune system that causes the psoriasis to happen. Other things like medications can also trigger psoriasis. Things like lithiums, the one you use to treat depression, and high blood pressure medicine, things like propranolol and other beta blockers, ACE inhibitors, some anti-malarial medicines like chloroquine, hydroxychloroquine, and indomethacin can also trigger psoriasis. Infections, and this is actually very common in children, and they present with gastric psoriasis, as I mentioned earlier. Those people with streptococcal infection, they tend to have a flare-up of psoriasis after the infection. Sunlight is actually good for most people with psoriasis, but it has to be mild. But for a few, sun can actually worsen the condition, especially if there's a sunburn. So if you have psoriasis, make sure when you go out, you get yourself protected. Wear like protective clothing and things like that. Skin injuries can also cause psoriasis to happen, like a color scrape or bug bites, infection, or too much of scratching can also trigger the condition. Weight is another problem. People who are overweight, tend to get psoriasis more easily. Weather also is another a major factor. People who are living in a very dry air condition and without less sunlight and very cold temperatures tend to get psoriasis problem more. So it's actually quite important if you do have psoriasis, try to keep your skin moist and try a humidifier at home. Now I come to the common treatments for psoriasis. And psoriasis, you need to know that psoriasis cannot be cured. What we're using now, the treatments, the different types of treatments are just to control the condition. It can never be cured. It can never be fully treated. Okay, there are many treatments, topical, oral, and light therapy. And some slow the growth of new skin cells and others relieve itching and dry skin. These are the commonest type of treatments we use to treat psoriasis. Okay, and these are topical treatments like steroid creams. Okay, steroids are commonly used in psoriasis treatment. Moisturizers for dry skin, as I mentioned earlier, psoriasis has got very dry skin, so moisturizer will be something to help to relieve the skin irritation. Coal tar is another medicine we use to control psoriasis, and normally we use it for scalp psoriasis that happens on the scalp. Okay, calcitriol and calcipotriene is actually vitamin D derivatives, which actually can help to slow down the progress of this psoriasis. And retinoid creams as well. Retinoid cream is actually a derivative from vitamin A, and all this can actually help to slow down the progress of psoriasis, but never fully treat the psoriasis. Okay, when the psoriasis becomes like not responsive to the topical treatments and the treatments that I mentioned earlier on, your doctor might have to use some light therapy. And light therapy means that your doctor shines an ultraviolet light on the skin to slow the growth of the skin cells. And PUVA is actually one particular treatment using the light therapy. It's actually a combination between what we call a medicine called psoralen together with ultraviolet A light to slow down the progress of psoriasis. As I mentioned earlier on, psoriasis arises from our overactive immune system. So the immune system is causing the skin cells to proliferate, to multiply at a very high rate. So an immunosuppressive treatment like methotrexate or cyclosporine actually are used to treat these sort of like resistant cases of psoriasis. When people having psoriasis problems which are so resistant to other treatments, the doctor have no choice but to resort to using the methotrexate and what we call immunosuppressive treatment. And these treatments actually come with a lot of side effects. So when you are under this treatment, the doctors have to closely watch the patients. You have to do regular lab tests and perhaps a chest X-ray, possibly liver biopsy, and this actually ensure a lot of side effects, and patient might not like the side effects. And another thing that we use for resistant cases of psoriasis is actually retinoids. As I mentioned earlier on, retinoids are vitamin A derivatives, can come into different forms: pills, creams, foams, and even oral, what we call systemic retinoids. Retinoids can cause serious side effects because retinoids can cause very bad, what we call birth defect. The fetus or the baby born by the mother who is taking retinoids can be malformed. So retinoids is another medication that causes a lot of side effects, including kidneys and raised blood pressure. So your doctor will have to closely watch you while you're under this treatment. Another treatment, which is the commonest treatment or the latest modern treatment we're using now, are biologic treatments. As I mentioned earlier on, psoriasis because of our overactive immune system, and immune systems are actually mediated by a lot of immune markers, a lot of cytokines and chemicals, and these treatments are being developed to target specifically on the cytokines and the immune mediators, so as to reduce the immune system and response in our body.
Okay, thank you, Dr. Chong. Dr. Chong, I just want to facilitate the floor. Just curious, just now when you mentioned psoriasis as well as eczema, this is actually all genetic, okay? All genetic. So does that mean there is 100% no way that it can be stabilized? That means it will just flare up as and when they want it. That means there is no permanent solution that will actually cure this.
You're right, Marcus. Being a genetic disease or condition, it basically means that the condition cannot be removed or cannot be cured from our body. Genetic means that when someone has the genes in the body, the genes, you carry the genes with you throughout your life. You cannot get rid of the genes.
I see. I see. Okay, then what are the situations like? They say the parents doesn't have it, but they have it. So how do we explain that genetically? So it's like it doesn't happen to their parents, but the children actually have it. So how do we explain this condition?
Okay, when somebody, let's say I have psoriasis and my mom and dad do not have them, okay, but you see, genetics can actually skip generations. My granddad or my grandma could have had it. So it's just that. So my grandma, okay, pass it to my granddad or pass it to my dad or my mom. Okay, as I said earlier on, not all the genes are being turned on all the times. Some genes are just they're just quiet. They don't turn on. So my grandma passed the genes to my mother, let's say, but in my mother, because there are no triggering factor there, so the genes are not turned on. So my mom doesn't present with any psoriasis. My mom actually will pass the genes to me when I have the triggering factors there, so I end up with psoriasis.
I see. I mean, so Dr. Chong, now what you are sharing just now is that basically the grandparents may have the gene, but it was not activated, and then when it passed down to the parents have the gene, but it was not being triggered. So it reaches the grandchildren, the grandchildren, maybe because of the certain diet or certain injury they have encountered or certain sickness that they have developed, that's where it triggers off the entire gene to create that skin condition.
Exactly. That's when the genes actually get what we call a switch on, and this is what we call epigenetic.
So epigenetic coming. Okay. Yes. If that is the case, then once, let's say, assuming somebody got the eczema or psoriasis trigger, is there a way to reverse this?
We can actually, when somebody develops a condition like eczema or psoriasis, we can definitely reverse it by using the different modalities of treatment, like the one that I just mentioned earlier on.
Those Western medicine, is actually target not to cure, but to reverse the condition, or to smooth, not to cure.
Not to cure, to control, basically.
I see.
To control, basically.
I see. Okay. Actually, to control but not to cure. Okay. So basically, when you say not to cure but just to control, means it's actually helping them to go through the transition. Correct?
Yes,
that means
definitely.
not the transition. I would say basically it got triggered already. It's actually helped them go through that triggering better in that sense. Okay. Curious. Just now you mentioned also that it is due to the cell growing too fast because of the immune system. What was the main reason why it started to grow so fast instead of the normal rate of growth?
And this is something that we cannot find the root cause of why the cells are being stimulated to overproduce new cells. And we know this sort of overproduction of cells, or the overproduction of skin cells, are actually mediated by an overactive immune system. And this overactive immune system, is actually caused by the genes that actually got what they call like a mixed-up signaling. So basically, it's actually an overactive immune system.
Okay. So overactive immune system, could it be because there are certain things that is being attacking the system, that's why the immune system is so overactive?
It can be. That's why we have these triggering factors. Triggering factors are actually factors that will trigger the immune system to become overactive or overdriven.
I see. So, curious, moving forward, based on what you are saying, is those triggering factors, could it be because of the diet that the person is having, or the lifestyle that person is having? That's why it trigger off?
We do not know, exactly by now what actually triggers the overactive immune system. As I mentioned earlier on, the lifestyles, the sunlight, the smoking, the alcohol consumption, and things like that can actually trigger the immune system. But exactly which one triggers the immune system, or exactly which one will actually end somebody up with psoriasis, we do not know. We just know that the ultimate problem when somebody develops psoriasis or eczema is because of an overactive immune system.
I see. So based on what you are saying, Dr. Chong, basically, can I safely say, actually the based on the lifestyle, the possible reason based on the lifestyle that you mentioned just now, also are those factors that created a lot of free radicals?
Oh, definitely.
Those factors are also the main factors that create free radical in the body. And as we know on the first series, the first chapter, the first time when we do it on Zoom, that free radical actually create a lot of situation where the whole system will go haywire. So could it be because of all those? That's why the reason created a free radical condition and leads to the skin problem.
We still do not know what exactly caused it, but we know that free radicals causes a lot of damages. You see, our body need to have a very unique situation, a very sort of like a aligned situation for us to function properly. If there's anything external insult like free radicals onto our system, there's potential for our system to go haywire or to go out of the alignment and start causing different problems, like having an overdrive immune system.
I see. Okay. So based on what I am hearing now, that means we do not know 100% what it causes it, what triggers it, but the possibility are because of the dieting, the habit that triggers a free radical condition, thus trigger to the next thing that is overall haywire in the system. So by doing that, we can just start from one simultaneously. Besides the Western medicine, we can also allow the body to solve the free radical condition from natural food by cutting the 小山 movement, correct? Would that be a possible?
Yeah, this is something that we can actually look into. It's definitely, I would suggest that we should be doing, because we need to provide our body a very good environment, to be free of any further damages. We know that there are a lot of things in our life, in our environment, the way we live, our lifestyles are causing a lot of free radical damages. So in order, for our body, for any system, basically not just only the immune system to function properly, we need to cut down on a lot of damages that can cause these sort of problems, which one of them is actually free radical damage.
The question is, we all know based on the clinical studies that we have shared and we have understand that in the market, antioxidant is one of the most important element to actually stop the free radical condition. Based on the clinical studies, would you say that astaxanthin is one of the most powerful antioxidant around?
Yes, from the clinical papers or whatever clinical studies that have been done all this while, astaxanthin is actually recognized as one of the most potent antioxidant in the world. Okay, it's much higher. It's about 800 times higher than vitamin C. I can't remember the exact figures, but when they do the study to compare between the antioxidant ability of astaxanthin as compared to other antioxidants, there are many other antioxidants like vitamin C, coenzyme Q10. They're all antioxidants here, but by far astaxanthin is the most potent one as compared to others.
Okay, and we have a questions that is being posed. What about compared to SOD?
Can I ask what's SOD?
Yeah, there's this one person called Miss Hui Wong. Would you mind share with us what is SOD? What's the exact word of SOD?
Oh, superoxide dismutase.
Superoxide.
Okay, good.
Yeah, okay.
As I mentioned earlier on, for those who have actually joined my the talk we had, the Zoom meeting we had the last time, our body has got two. You see, antioxidant, what we call antioxidant, there are two types actually. One is called what we call endogenous, the other one is exogenous. Endogenous means that our body itself produces the antioxidants, and superoxide dismutase is something our body produces. It's not from the outside. Okay, things like astaxanthin and things like vitamin C, coenzyme Q10, they're actually what we call exogenous antioxidants. So they actually from outside, maybe from plants and things like that. And we cannot compare the astaxanthin and superoxide dismutase. There's no way for us to compare the two systems together. So I can't give you a figure as to which one is better, because we just cannot make a comparison.
So Dr. Chong, what you are saying is superoxide dismutase is actually produced by the human body itself. It is not able to consume from outside, correct or not?
Exactly, yeah. What we are trying to do now, external antioxidant is something to supplement our internal antioxidant ability to combat.
I see. So that would mean which some of the products that we get outside, they claim it is SOD, it is actually not as such. It is actually helping the body to produce SOD. Is that what you're trying to say?
Yes, they can help the body to produce the SOD, but they are not in
not
any way the replacement.
Okay, Dr. Chong, would you mind allow me to share something about the Asentar on the astaxanthin, since we're talking about antioxidant at this point in time?
Yeah, sure.
Is it okay, Dr. Chong?
Definitely.
Okay, good. So, allow me to share what Asentar can actually do when comes to this entire skin condition. So I hope everybody can see. So how do Asentar's antioxidant, the astaxanthin, able to help in this particular situation when it comes to free radical? First of all, based on the clinical study, astaxanthin has a very good skin protective mechanism, all right? A very, very good one. Not just specific on solving the free radical, but through free radical, cutting down on the free radical conditions, able to lead to specific on skin protection and on skin. Basically, first of all, antioxidant activity as well as anti-inflammatory properties, so that to actually helps to ease on the flare up in that sense. Next, we will see is based on the antioxidant activity and based on the clinical study, astaxanthin has shown to have greater antioxidant activity than any other carotenoid against oxidative sun damage to human skin cells. So this particular case specific on sun damage, okay? It was also shown to upregulate the immune system, okay? Unregulate the immune system, defense against oxidative damage to irradiated cells, and to promote wound healing. Okay. Next one, anti-inflammatory properties. Psoriasis and atopic dermatitis, eczema are hereditary, chronic inflammatory skin diseases. And studies have shown that astaxanthin inhibits inflammation by interfering with gene expression of several pro-inflammatory biomarkers in keratinocyte, okay, which is the skin cells. Right, next one, in conclusion, just to cut the whole thing short, easy, this inhibitory of Asentar Astaxanthin effect is very important for the anti-inflammatory drug development for skin infections, including psoriasis. Astaxanthin also prevents skin thickening and inhibits collagenase inflammatory mediators and thus responsible for anti-wrinkle effect as well, in the sense, okay? So having said this, many people would have just go gaga, okay? Because it's so technical, okay? Basically what it is actually saying is this. Hold on, what it's actually saying is this. Dr. Chong, would you mind help me along the way? Basically what it is saying is because of the astaxanthin antioxidant effect, it's able to help the body from solving the free radical at the electrons level, and then thus it will actually help in rebuilding the atoms, rebuilding the cells, and then from there go to tissue to organs to system to the body. Can we safely say that actually?
Yeah, that's definitely the case. We know that there are a lot of damages are being done by free radicals. Okay, free radicals actually do damages down to our most basic, what we call that, atoms in our bodies. You know, atoms are basically in the cells. Okay, so if you can restore or you can prevent this sort of like free radical damages, our cells can become healthier. Okay, when healthy cells or healthy atoms are there, they can form healthier cells, and when healthier cells are there, they can form healthier organs, and healthier organs can actually form a healthier human body.
I see. So, Dr. Chong, would you suggest those who have a skin condition now? There are a few ways to do it. One is taking antioxidant by astaxanthin. And then secondly, their diet and their lifestyle will have to make some adjustment. At the same time, they use medical treatment to help themselves to go through the transition. Would these three be enough to do the reversal actually? Or rather, possibility of helping?
As I say, you know, in order to get yourself healthy, in order to get something under control, you know, don't just rely on medications. You have to live healthily. You have to do something as much as possible to actually make yourself as healthy as possible. And of course, you have to combine with, you know, like things like oral supplementations like astaxanthins, antioxidants, and supplements to actually get a more rounded approach, you know, in dealing or in what we call addressing the condition. And by doing these sort of things also, I cannot guarantee, like, by doing these sort of things, like, you're definitely going to cure yourself from psoriasis. But the chances are getting a better control of psoriasis is much better compared to people who are not doing anything at all.
Okay. Thank you, Dr. Chong, for reminding. Basically, you have pointed out one very important point just now. As we all know medically, psoriasis as well as eczema, this has no cure, be it whether Western medicine or natural cure. However, key point is it is easier to control the condition or possible to reverse it if we do all prongs of attack to protect our body. Is that what you're trying to say?
Exactly. Yeah, we're just trying to, you know, like address a problem from all possible angles.
Okay. So with this, let's move on to the next segment. Will be the Q&A. Okay, Dr. Chong, we will go through the Q&A now. So it's open for the floor for any questions. Anyone have any questions? Yeah, you can type in the message. So anybody have any? Okay, all right, good. There's someone asking, Dr. Chong, Margaret, I wish to ask a question relating to heart blockage. Oh, okay. Dr. Chong, now suddenly got one question on heart blockage. Okay. Yes. And not on skin, but on heart blockage, okay? Patient has 3 artery blockages. 2 stents were inserted, but last choke artery cannot be done, and it is too fine. As a result, patient constantly experience water retention and weakness, often going to hospital. Will Asentar able to help? I think what she's asking is, will taking Asentar Astaxanthin and antioxidant level, what it can do, would it be able to help the blockages, which is lead to the high blood pressure condition where we shared last week, actually, or rather the last chapter, last Zoom session?
Okay, yeah, this is actually a very quick question. We have actually touched on these sort of things in our last sharing. You see, looking at the condition or the story of this case, I think the patient is actually having what we call heart failure. Okay, because when you have this sort of like blockages on your heart, and we don't know, I don't know, maybe the patient has already had some heart attacks whatever before, so some of the heart muscles are already damaged. So when heart muscles are damaged, okay, that person will go into water retention and weakness, because the heart will start failing as a result. Okay, and I've mentioned earlier on, okay, there are so many things that can cause our arteries to get choked or to get blocked. Okay, not just cholesterol being high, and when your cholesterol is high, you really need something like a periodical damage to cause your arteries to be blocked at a higher rate. So if patient has got like heart blockages, they have got heart problems, they have got this sort of like a vessel diseases, taking antioxidant, I would strongly advise, it would definitely help, because a lot of times, it's not just the cholesterol being high or something like that cause the arteries to be blocked. It's because of the free radical damages that cause the cholesterol to be more harmful and cause the vessels to be more easily blocked. So antioxidant will be something that that person I would strongly recommend. But whether this antioxidant is going to cure the person, or is going to reverse the heart failure and water retention or not, I cannot ascertain. I cannot actually assure. But definitely it can add treatment to the heart problem there. And of course, by taking this antioxidant doesn't mean that the person needs to stop the heart medication. He or she still needs to continue with the doctor's follow up, to go for regular checkups and things like that. But by taking the antioxidants, maybe his condition might not deteriorate that fast. It can be slowed down as a result.
Okay, so for Ms. Sun, for asking this question, actually please log on to our last session in our Facebook. In our Facebook, we have the entire session on high blood pressure, so you can actually log on to our Facebook Center Live page. Okay, you can find Dr. Chong's session there, or on YouTube Center Live you can find specific on high blood pressure. So now let's open question further. Those who wants to ask more regarding skin issue, please feel free to ask the questions on the skin itself. So while you are typing the questions, Dr. Chong, would you mind if I ask, when you say when the person develop triggered the gene because the immune system is overactive, now what causes the immune system to be overactive? Could it be because of detoxification function of the liver, as well as the bloodstream that is being injured and then virus attack? Could it be because of that?
There's so many possible explanation or causes for the immune system to be activated, in such an overdriven way, and until now we cannot ascertain as to what exactly triggers the immune system to be behaving in such a way. And of course, as I mentioned earlier on, like all the lifestyles, like talking about the smoking, the alcohol consumption, the over exposure to sunlight, stress factors, which is very important in triggering the immune system, all this play a role. But exactly what causes the immune system to be overdriven, nobody knows. We're still at the very beginning stage, early stage, like to try to understand the pathogenesis, the causes of this sort of like autoimmune or overdriven immune system problem.
So basically, Dr. Chong, at the end of the day, could it be, since in the Western medicine we cannot ascertain what actually is the cause and there is no cure, it is everybody's own responsibility to take care of their health in terms of their diet, in terms of their lifestyle, in terms of putting the right supplements to actually help the body rather than save on the supplement. Is that what I'm trying to say? And then hopefully that when the medical bill comes, then they got money to pay.
That's actually I agree very much to that. I'm an anti-aging doctor. Okay, we are now into this era of what we call preventive medicine. We are just not trying to treat somebody or to cure somebody from getting better after they've got sick. We are trying to prevent somebody from getting sick, from the very beginning. Okay, so by investing in your health, we know, by now, free radicals, inflammation, and these sort of things are contributing to a lot of diseases, what we call the chronic diseases in our body. So we know that this thing happens. Why not invest now? Invest now. Why not, do something, that can combat, this sort of free radical damages and inflammation, rather than waiting things to happen at a later stage. Only then we start going for treatment for the diseases, which has already happened.
I see. Okay, good. Thank you, Dr. Chong. Now we have one question. I want to know that what causes eczema for young children at the age between 5 to 10 years old?
As I mentioned earlier on, eczema has got a very, what we call, predilection in what we call genetics. Same thing like psoriasis, we cannot ascertain as to what causes the eczema to come on. But we know that this is genetic, this is hereditary. That means that person, a child having the eczema must have actually inherited some genes from the parental descent, either the grandparents or the great-grandparents or the parents themselves. And when the genes are switched on or when they are triggered, they will start developing eczema.
Okay. So the only way to solve it is to actually provide a healthier diet and to make sure that it is able to help the child to reverse, right? Is that what you're trying to say?
Exactly. As I've mentioned earlier,
okay.
Eczema and psoriasis and these sort of inflammatory diseases, there are no cause. We still cannot know. We still do not know why they happen. But we know that the condition involves inflammation. It involves a lot of triggering factors. So our approach to treating these diseases will be to control the triggering factors and to try to stop the inflammation.
Okay, thank you, Dr. Chong, because I realized what you have just mentioned was exactly what I did. Because my son, when he was born, actually he has a skin condition, and then after that we came back from the hospital. What I did was I was using, because of my lineage from Dr. Bernard Jensen. So what I did was I mixed in a center we have two ingredients. One is astaxanthin, one is Chlorella sorokiana. So what I did was, based on that lineage and knowledge, what I did was I pound the Chlorella sorokiana, make into powder and mix with the milk. And then when the center came along, I also mix in the milk. After 1 year today, thank God, I'm not saying that my son is totally cured, but I would say the entire condition is being reversed. Until now, the eczema never flared again until today. This is my own son, own personal sharing. So with Asentar Astaxanthin as well as Chlorella sorokiana being the formulated one at this point, I would say, based on my own personal opinion, it is very, very helpful when it comes to solving children's eczema. This is very important. I hope that can help this lady regarding the 5 to 10 years old. And my son today is 2.5 years old and been taking Asentar for almost 1 year already. And earlier on the 6th day, started taking Chlorella sorokiana already since baby in that sense. So but I understand what Dr. Chong say, that there is no 100% already cure. There's no 100% evidence that it will do this. However, luckily, because of the clinical studies that we have, what I do as a father, and with the lineage that I've learned from Dr. Bernard Jensen, so what I did was I actually mixed it into the milk to allow it to help in that sense, okay? So now, Dr. Chong, we have another question. Does it mean that astaxanthin is good for everyone, including cancer patients?
Okay, this is actually a very, very good question. You see, astaxanthin, or what we call antioxidants, are not they are not medications. We don't use them to treat diseases. We don't use them to reverse a condition, okay? We just know that, they are something that can help our body to stay healthy. They can help our body to slow down, to sort of like slow down our body from going into something, something more sinister or something, a disease, okay? So astaxanthin is actually good for everyone because it's not a medicine. It's not a medicine. It's actually a supplement. So it should not. If it doesn't do any good, it doesn't do any harm. Understand, no?
I see.
So
I see.
is supposed to be good.
Yeah. Okay. I understand. It's like a food source rather than a medication.
Exactly. That's why we know astaxanthin can help. A lot of like conditions or a lot of like what we call that conditions that can cause our body to deteriorate, our body to go into like unhealthy situation. So by taking astaxanthin, so that our body can slow down, so our body can actually go into this sort of condition in a quick way. So basically, astaxanthin is not, it's something that is good for everyone. It's not something that treats, but it's something that helps people to prevent themselves from getting sick at an earlier age.
I see. So Dr. Chong, what you are saying effectively, if let's say all of us take about 4 kilograms of broccoli, about 1 kilogram of carrot, and then 1 kilogram of, if we eat all the greens and all the different color vegetables, we would have actually get enough antioxidant that we're supposed to get. But rather, most of us are not doing that. We are not eating healthily. Is that what you're trying to say?
Exactly. Yeah.
Okay. Okay. We have one more question, Dr. Chong. It says here, after chemotherapy from breast cancer, my friend had hives, HIVES. Okay. What causes it? Is it that her immune system is then low after chemotherapy? Okay. The question is on chemotherapy on breast cancer, and then the system developed hive, the skin.
Okay, this is chemotherapy for breast cancer, and then the friend developed hives. Okay.
Yeah.
And hives normally are what we allergic response to something that causes the allergy in the body then, okay? But I do not think, hives are due to the chemotherapy. Maybe it's just something that occurred incidentally. Because chemotherapy actually suppresses our immune system, and hives are actually caused by an overactive immune system. So it's unlikely, or it doesn't really make sense that any immunosuppressive treatment can cause hives to happen, unless the person is actually really allergic to the chemotherapy itself. Not that the chemotherapy has caused the immune system to develop hives, at a later stage.
Okay, Dr. Chong, based on this particular situation, could it be because in the chemotherapy session, the radiation will kill the bad cells, but it will also harm to the good cells? Could it be because of that, after that, the diet never eat properly, or rather the system is not able to absorb, the body is not able to absorb the right nutrition? That's why other factors actually comes in.
There are actually many causes, because it's just too wide for me to actually draw a conclusion here. And think, she probably needs to have some allergy testing as to what is actually causing the hives to happen. Because there's so many other possibilities, it can be different things, the change in diet, the ingredients of the chemotherapy, maybe any other medications, the patient is taking. All these sort of things have a chance in causing the hives to happen. So it's difficult for me to say whether chemotherapy and the hives are related or not at the moment. But I can be quite sure hives is a heightened immune response. A heightened immune response causes hives, and chemotherapy actually reduces the immune response. So chemotherapy and hives, they should not come hand in hand. It should be the other way. It should be the other way.
That means I see. Unless there is other factors attacking the body system, that's why it triggers the immune system. I'm curious, Dr. Chong, I want to ask, I have this question always in my mind. Usually I realize that people that have skin condition, they are always related to the liver and always related to the blood in the body system. This is something that I have an idea, but just want to clarify with you. Could it be because of the food that they are taking? Example, in today's world, all the poultry, all the meat has a lot of chemical inside that's injected in them. for seafood and fish, there's a lot of heavy metal due to the pollution in the ocean. Could it be all these stuff that they are taking actually triggers off many things in the immune system to fight all these substance that is being put into the body?
That's very true, actually. Our bodies are designed, to actually sort of absorb things natural, to take ingredients and micronutrients which are natural, and our bodies are never designed to take in toxins, to take in heavy metals, to take in toxins, colorings, chemicals, and things like that. So if we talk about, like our bodies being bombarded by too much of chemicals, too much of toxin, so to speak, I'll definitely say yes. These are actually detrimental to our bodies.
So
and
that
it will
means
overburden
based
our
on that.
liver.
Yeah. Okay. So overburden our liver. So, and blood being the transporter of the whole body will be affected as well in that sense. I
Exactly.
see. Okay.
So toxins do not only reside in the liver, it will go to every single part in our body there. It can go to the brain, it can go to the heart, it can go to the kidneys, causing like brain cells problems like neuron degeneration, causing our heart muscles to weaken, causing our kidneys to actually degenerate faster at a faster rate.
I see. Okay. So just now there's one particular question asked, what kind of diet is suitable for people with skin diseases? Would since we have a lot of toxic meat and all the chemical that's involved in the seafood, could it be possible to ask someone to recommend them to actually stop eating meat, processed food, dairy, as well as seafood and all the things for a while to let the body rest actually? Is it possible?
It's definitely advisable, for the person to be going on something what we call organic. Organic means that something very totally natural, without any added chemicals, without any added pesticides or any fertilizers. It's definitely good, for that person, to go on something really natural.
I see. Okay. Then Dr. Chong, we have one more question. Can lung cancer patient take Asentar because he refuses to go for chemo?
Okay.
Don't want to go for chemo. Lung cancer patient don't want to go for chemo.
This depends on what stage of lung cancer the person is actually at the moment. Okay. But as I mentioned earlier on, Asentar or Astaxanthin or antioxidants are not treatment for any. They are there to make a person more healthy, but it's not there to treat a condition or to reverse a condition, definitely.
Yes,
so if you ask me whether a lung cancer patient can take Asentar or not, or take antioxidant or not, yes, of course he or she can. But I have no guarantee, there's no assurance that, that person taking this Asentar or taking this Astaxanthin or antioxidant are going to reverse their lungs cancer condition. It will probably improve their life quality.
Thank you, Dr. Chong. Based on this, for this lady, thank you for asking this specific question, because we do have a testimony from Hong Kong. What we do is also a cancer patient, but what we advise is they do go through the chemotherapy, but at the same time supplement with Asentar. So she takes 4 capsules before chemo and 4 after chemo. Actually, just imagine Asentar is a food source and ingredient for the body to heal back and helps the body take the nutrients to actually detox the radiation from the chemo. So as a supplementary, but not to remove, not to say take over, you do this, take Asentar and don't need chemotherapy. That is not the right thing to do. Asentar is not a miracle drug, it is not a medication, it is a food source. It's an ingredient to provide the body, to let the body heal. All the miracle is done by the body, not by Asentar. Remember, Asentar provides the source. The body and the cells are the one that create the miracle, because we are not getting enough of the good stuff from the food that we are taking. Okay, I hope that can actually answer you. Okay, Dr. Chong, due to our time constraint that we have coming to an end, we can take one more questions. Dr. Chong, is it okay? We can take one more questions. Anyone with one more questions before we end tonight's session? Okay, let's see. Anyone have any more questions for tonight? Okay, don't have, then Dr. Chong, we have come to an end for today's session. And thank you everybody for joining in this particular session. With this, thank you very much for spending the time to log on to actually join in for this session. And thank you, Dr. Chong.